Good morning, everybody. In the previous video, we have discussed why a disease called autism is increasing in the Indian society, in our kids. In this video, we will discuss what are all the symptoms which the parents should be aware of and when should they meet their physician or the pediatrician, and what care they should take when their kid becomes autistic. Now, autism can start at any age. It can start below 1 year, after 1 year, after 2 or 3 years. But if it starts below 1 year, it may be difficult for the parents to interpret the symptoms or diagnose the disease. They may overlook the symptoms. So, symptoms below 1 year will be something like this, like the child does not look properly into your eyes. The child may not respond to the oral commands, and a child normally, a 10-year-old or 12-year-old child should play pat cake. That is, if we clap, they should clap back. This child does not clap back, and you try to play with him, but the child is playing within himself. So subtle symptoms may be there, but parents may overlook, thinking that okay, he will grow after 1 month, he will grow after 2 months. Some uncle got speech after 1 year, or another uncle started walking after 2 years. So they may have some customary thoughts. So most of the times the parents will overlook the symptoms. But if the same symptoms happen after 1 year, then parents should be very cautious. It is easy for them to identify. Like a child more than 1 year not responding to commands. You talk to him, he looks somewhere else. He doesn't look into your eyes. He may utter some words which are incoherent, like you ask him something, he's speaking about something else. He doesn't look into your eyes, or even if he looks into your eyes, he immediately shifts his gaze to something else. He looks at something else. He plays within himself. He is not mingling with the other kids. He is not replying back, or he is not responding to your commands properly. If such symptoms are there after 1 year, then the parents should be extremely cautious. They should suspect that there is some problem, and they should immediately meet their pediatrician. And it is very easy for a pediatrician to diagnose that the child is having a problem, and the pediatrician will interpret the symptoms and decide whether the child is having autistic features, or the problems which are there are because of any other issue. If it is any other issue, then he will deal with it accordingly. But if the pediatrician says that the child has autistic symptoms, then the parents should become alert. Okay. Now there are many. Then the parents should think about why the child has become autistic. Now we have discussed in the previous video about the various reasons as to why a child becomes autistic and why more and more kids are becoming autistic of late. One of them is a genetic problem, and others are mobile related, over mobile viewing, over TV viewing, over gadgets, loneliness, etc. and etc. Now, if it is a genetic problem, the problem is something different. But if it is not genetic and it is because of the over mobile viewing or over television viewing, or the child is always engaged with gadgets, then lonely child, then if that is the problem why the child is becoming autistic, then the parents should immediately shut down their mobiles, shut down their televisions, and they should close off all the gadgets. That's the first thing they should do. And then they should start engaging with the child themselves, and they should keep the child in more and more, they should not keep the child lonely at home. They should take the child out and try to see that the child mingles with more and more kids or more and more people, and he moves around. If he should not be left lonely at home, and the parents themselves should keep engaging the child all through the day. Now, if it is if it is a very early symptom, if it is diagnosed pretty early, then this should be enough. The child will gradually recover. Most of the time, the child recovers. But if the diagnosis is done late, the parents neglect these symptoms up to 2 years or 3 years sometimes. Now, the diagnosis is made after 2 to 3 years of onset of symptoms, then there is a problem. Then child becomes severely autistic. The child is not looking at the eyes of the mother at all. not speaking to the parents, not speaking to anyone, just speaking with himself, not mingling with anyone. That is very severe autism. If the child reaches such a stage, then that's a problem. Parents should not allow the child to go to such a stage. But if it happens, then they should take the advice of their pediatrician and then meet a psychiatrist, either a clinical psychologist or a pediatric psychiatrist, and then they will advise you further managements like behavioral therapy, occupational therapy, speech therapy, etc. There are some special techniques which they use to calm down the child, decrease his hyperactivity, increase his concentration, make him mingle with others, etc. There are some examples, like there is a scrubbing which is done, and the child is sometimes kept in a dark room with a disco light on, and child is asked to concentrate on the moving lights, which will help improve his concentration, etc. So there are some specific therapies. They will teach you those therapies. You should learn those therapies and then do them at home. One mistake which the parents do is concentrating too much on speech therapy. Now the speech, the parents feel that the child is having a problem with speech, who is not speaking properly. But here the problem is not with the throat, or the problem is not with the voice, problem is with the mind. The child is not mingling with you properly, he doesn't want to speak, so he is not speaking. So don't concentrate too much on speech therapy. Concentrate more on behavioral therapy and occupational therapy. And the behavioral therapies and occupational therapies help in bringing down the hyperactivity of the child, improve his concentration, allow him to mingle with you. And once the child starts mingling, he will automatically start speaking. Okay, then after that level, then you can go for some speech therapy if required. But don't concentrate on speech therapy itself from the beginning. This is the mistake which many parents do. Right. Then along with these therapies, then you should do all the remaining things, like which we have already discussed, like shutting down the gadgets, engaging the child always, and taking him out. Like he should go to school, number one, and he should at least go to a play school. One mistake which the parents do is not sending the child to school. They feel that, okay, even if he goes to school, he is not mingling with kids, so let us send him after 6 months. That's a standard mistake you should not do. You should send the child to the school. Even if he is not mingling with the other kids, the kid should go to school. Let him be alone there for weeks together, but gradually he'll learn things from the other kids. That is one. Then that also you should do. As far as possible, you should send to the maximum number of hours to school, like 7 to 8 hours, not just sending for 1 hour or a half day, nothing like that. So morning to evening, the child should be with kids. And after coming home also, even in the evening, again the child has to move out. He should not stay alone at home. You should take him out somewhere, engage him in the evening also. Don't leave him alone. Like examples, like it's very simple. You can take him, you need not search for places to take him. You can I'll just give you a simple example. You can just take him to a bus stand and sit on a bench for 1 hour. That's more than enough. You can go to a railway station and sit on a bench for 1 hour. You can go to a market. Just allow the child to see people. If you go to a bus stand and sit on a bench for an hour per day, initially, a child may not show interest in the surroundings, but gradually, when you go for weeks and months together, then gradually he will start observing others, and gradually he will start mingling with people. So, as far as possible, the child should be among people, maximum time among kids, right? So, if as long as the child is awake, he should not be kept alone within 4 walls. He should move out of the house. Even if he is within 4 walls, he should not be alone. He should be engaged by somebody at home. If both parents are working and there is no somebody to engage the child, one of them should, even they can resign their job and stay with the child. Okay? Otherwise, it becomes pretty difficult to bring the child out without a family support. Right? So, along with the occupational, behavioral and speech therapies, these things should be followed carefully. And these are more important than the therapies, like keeping the child engaged, shutting down the gadgets, etc. Because we see parents who just concentrate on behavioral therapy and occupational therapy, which is done in the psychologist clinic, and after coming home, they just leave the child like that. Give him a mobile phone and leave him like that. There is no use, right? So, all through the day, the parent should engage the child in some form or the other. That is the most important thing. Now, if it is diagnosed early, the kids generally come out fast. But if you diagnose late, It may take even weeks, months, or even years for the child to become normal. So there should be lot of patience on the side of the parents. You should be very patient. Don't expect miracles to happen. Gradually the child will come out. But if you are patient and follow all the protocols properly, the child will generally come out of the problem, except very rare cases where there may be an issue even after years. But majority of the times the kids will come out of the issue. Right? So ultimately the parents should remember that the most important thing for managing autism is early diagnosis of symptoms, early diagnosis of disease. So be aware that there is a problem called autism which is happening in India now because of over mobile viewing or over gadget usage in the early days. So avoid that first and be alert to all the symptoms which we have already discussed, because the kids will come out early only if you diagnose early. If you miss early symptoms, late diagnosis will create a lot of trouble for the kids in the future. Thank you.